Well, welcome. My name is Dr. Hugh Wegwerth. I'm a functional medicine doctor here in the United States in Minnesota. And if you're watching this, you may be watching this all over the world. So welcome. I want to go over this case here. It's a very interesting case. This is actually a medical doctor from Afghanistan who is 45 years old. His specialty is actually he's actually a neurologist, so he has lots of training from Afghanistan. I'm going to walk you through his initial paperwork. I'm going to walk you through his labs. I'm going to walk you through his treatment program. Now, as you go through these different case studies here, it's critical that you go through these case studies because you're going to see very similar treatment programs for these Floxies, meaning that clinically what I found here with working with Floxies is that there's a basic foundational program that every Floxie needs. And if you can get this basic foundation in, the probability of you getting better is much more increased greatly. Now, there's always outliers that need a lot of very specific attention and a very specific functional medicine programs. But in general, clinically, these cases I'm going to go over, you're going to want to go through these cases because there's basic kind of common threads through all these functional medicine cases working with people that have been floxed. So this medication is very horrible, as you know, and it should be taken off the market. So let's just go over this paperwork here. So he's a 45-year-old doctor. Now, he presented with a lot of neurological problems: agitation, loss of interest, low energy, suicidal attempts, brain fog, crying. I mean, he just had emotional, unstable, suicidal thoughts that were happening to him after he took this medication. Now, what I believe is obviously this medication affects people differently. And I believe sometimes this medication can get very deep into the brain and affect the mitochondria and affect the neurons and affect how the neurons fire and cause very specific problems. So, this was pretty significant cases. I mean, he wanted to commit suicide. He lost interest, lack of energy. Just the life of him was taken out. So this is basically what we want to go through is when you look at your body, or when I look at someone that's been floxed, I want to look at all the different systems, because when God created us, he created all the systems together. We're just not a thyroid, we're just not a GI system, we're just not a brain. You have to look at the whole entire system. That's why this paperwork is so critical. So the first thing you're going to see is this is the colon. How's the colon health? How's your digestive system? 70 to 80% of your immune system is located in your digestive system. So let me say that again. 70 to 80% of your immune system is located in your digestive system. So if you have a bad digestive system, you're going to have a bad immune system. Now, your gut, your digestive system is intimately connected with your brain, and your brain is intimately connected with your gut. So if you have a bad gut, you have a bad brain. If you have a bad brain, you have a bad gut. So the first thing I want to look at is how's the digestive system. Every Floxie needs to start with a digestive protocol, period. Clinically, this is some of the basic things that you want to start to do is start with your gut and then work from there. Why? Because 80 to 90% of your immune system is located in your digestive system. So let's go over his gut. So he has abdominal intolerance to sugars, starch. Guess what he's eating? Most of his diet is carbohydrate based. He has gas, he has diarrhea, he has stool problems, or he has diarrhea, he has constipation, small stools, large amounts of gas here, leaky gut. There's no doubt that he has leaky gut. You can see he has a lot of twos in here. So his gut definitely needs to be addressed. Heartburn, spicy foods. This is another gut problem. And you can go and relook at this, and you can take some time, but I just go over all these because I want to see like what's happening with his physiology overall, so then we can come up with a very specific treatment plan. Now, if you're just going to do the online course, take this information and apply the certain supplements strategically, one thing at a time, and move forward from there. So a lot of sluggish, cold hands, require huge amounts of sleep. This is just telling you that his brain's not functioning right. Heart palpitation, decreased libido. All these things have to do with a nervous system that's taxed, right? Mental fog, night sweats. So he's only taken omega-3 fish oils. So now here, this is the most critical. This is the brain localization. I like this because each part of your brain, like this part of your brain, and this part of your brain, and this part of your brain, and the under part of your brain, all do different things. So this can isolate what's happening. So the frontal lobe right here is what makes human beings human beings. This is the ability to plan, make decisions, to have some interest in life. So you can see right here that this here, his frontal lobe, is very compromised, and that was very affected by being floxed. So the frontal lobe here is basically right in this area, right in here. So what do we need to do? Like when I see all these neurological problems, the first thing that we need to do is fix the gut, and then we got to give the body good, healthy fats, because your brain is all fats. Your nervous system is all fats. So you need to superload on these supplements so your body's getting enough fats in there. So you can really see here that the frontal lobe, he has a lot of 2s, 3s, so a lot of this is strewn in here that he has a lot of frontal lobe problems. Now you can see as soon as we move out of the frontal lobe, right now it goes down to 0, 0. So the frontal lobe was definitely affected. See in here he has all zeros. Parietal lobe, they just do certain things in your body. So here he had some cerebellum, which is right in the back of your head, some dizziness problems that were happening to him. Now, one of the things that happens too is when you have deep problems in your brain, when the medication, fluoroquinolones, affect your brain, this can cause your emotional centers, because all your emotional centers are really deeply located in the middle part of your brain, and I feel that this medication, fluoroquinolones, are highly absorbable, and they go right in the fat tissue, right into the brain, and in some people, it'll really affect the emotional centers. Now here, the brain here also controls the brain controls your ability to relax or to be like running away from a tiger. So in him, the medication affect the centers that cause a lot more stress and a lot more anxiety happening. Tingling in his body. Okay, so here I called him up. Actually, it was a Skype call, so you can see when this was. And you can't really see you can't make out my writing, but I'll tell you it's depression, brain fog, suicidal thoughts, increased tension, hopelessness, agitation. He's crying all the time, suicidal thoughts. Here, what I thought was interesting is major brain fog, can't think, his brain's not working, brain fatigue. I asked him about his digestive system, and he initially took fluoroquinolones because he apparently had some kind of GI problem, and they gave him fluoroquinolones, and that like totally took him over the edge. Now, I did ask him prior to taking this medication, did you have GI problems? And he said yes. His whole life he had gas and he had bloating and he had abdominal pain. So right there, like when I talk to someone, they say, yeah, I've had these problems for a long time. This gets my brain thinking, well, the body's physiology just was weak to start with, and then this was the straw that broke the camel's back. He has nightmares, waking up in night sweats, anxiety, heart racing, thinking he's going to die, his chest is tight on him. All these things are happening. Now remember, this guy is a doctor, a medical doctor, a neurologist in Afghanistan. So he's had lots and lots of training. So here's his labs. So you can see Afghanistan, and you can see the patient name. This is the doctor right here, and its referring doctor is himself. So he is actually a medical doctor, a neurologist in Afghanistan. And I'm not going to go over all these in detail. I'm going to go over some highlights here. So this right here has to do with your blood and how your red blood cells are. You can see that's high. Red distribution is low. So he has some red blood cell things that are abnormal. Right here, your neutrophils right here, I like to see this less than 60 functionally now. So this tells me that he has some kind of bacterial infection. I think he actually has, or some kind of not bacterial, bacterial infection. I think his gut's so bad that he has small bacterial overgrowth, and that's causing his neutrophils, which are part of your white blood cell, that go out and try and get rid of these bad guys. This is an inflammatory marker here, your sedimentation rate, your SER it's called. You see it's 18. You see this is the normal range. I like to see this less than 5. So right away we know that he's inflamed. So if you have a bad gut, you're going to be inflamed. If you have a bad gut, you're going to have a bad brain. If you have a bad brain, you're going to have anxiety. You can have nightmares. You're going to have tension. You can have like your heart starts to beat. You can wake up with night sweats, right? You can feel like you're going to have a heart attack. All this stuff is happening because your body is chronically inflamed. So he was able to get these here. Your triglycerides right here is his triglycerides are 165. I like to see it's less than 100. What does this represent? That he's eating too many carbohydrates. Like carbohydrates cause inflammation. Carbohydrates cause small bacterial overgrowth. Carbohydrates cause your body to be in a state of inflammation. And one of the things that we want to do is all diseases grow in a body that's inflamed. So we want to eliminate the inflammation, get to the root cause, and start normalizing your body's physiology and figure out what's happening here. The glucose here, this is a fasting sample. You see the lab here. Like I actually like to see this around 85 is optimal. So he has blood sugar dysregulation. So anytime you have high glucose levels, it means that you're chronically inflamed. Just imagine this. Is when you have high glucose, it's like shards of glass floating around your bloodstream, scraping things. When that starts to scrape things, that causes inflammation. If your brain is susceptible, that's going to cause more inflammation in your brain, and that's where the fluoroquinolones are really going to take hold and cause havoc. All right, this is key here, insulin. All right, so what happens is when you eat food, specifically carbohydrates, your pancreas produces insulin. Now you can see this, he's at 44. You see this range here, 2 to 25. Functionally, I like to see this around 5. So what does this tell me clinically when I see something of 440? It's telling me that he has major blood sugar dysregulation. Like insulin is pro-inflammation. This is a pro-inflammatory hormone. Insulin is actually a hormone. So if you have high insulin levels, this is bathing your body in inflammatory proteins. If you're already susceptible because you've been flexed, those tissues that have been damaged are more susceptible to damage because you're being more inflammation, more insulin, and more glucose is heading to that area, affecting those tissues. Then also here he has hormonal issues. This is a female hormone, estradiol, 44. Look at the range. Like you never want to be on the high range of hormones, especially when they're female hormones. So in here, this is free T3, is a sluggish thyroid. You see it's 2.8. You can see this range. We want this to be around 3.5. So he has sluggish hormones, and we know that he is chronically inflamed as well. Now B12 here, you can see this here is B12 is 174. Functionally, I like to see this at least 500. So what does this tell me? This tells me that he also has a malabsorption problem. He's not able to absorb nutrients, and if he's not able to absorb B12, he's probably not able to absorb many, many different nutrients, magnesium, selenium, B6, B1, manganese, magnesium, right? So you can just assume some things here that if you have a bad gut, you're not able to absorb all your nutrients. If you're chronically inflamed, that's going to hinder your ability to absorb nutrients as well. Now his vitamin D is in the tank. It's 12 right here. You see this, right? We want this to be at least like 80, right? So he's at 12. And we want this to be at 80. Vitamin D is linked to every disease process known to mankind. So that's his lab. So now let's go on to a treatment program. So you have to remember he's in Afghanistan. So what I did is I gave him a big treatment program so he could order the supplements from Amazon and get them there. So the first step we did is I put him on a ketogenic diet. He had to get rid of his carbohydrates. You gotta get rid of your carbohydrates. You have to start eating good, healthy fats. And in this in the ebook here, the e-course here, the online course, I'll have references on, what are good healthy fats and change in diet. So you want to eat a ketogenic diet. So I had him Google that. You got to cut down the carbohydrates. I had him do this. This is also in the course here, is the HCl challenge test. You have to do this HCl challenge test. Must. We must need to make sure that you have enough hydrochloric acid in your stomach. In my opinion, clinically, this has been the #1 most significant, most efficient, most economical test that I've done to help people clear their digestive system. So this is what it looks like. It's all on video. And then he uses the supplements to buy where you buy them on Amazon. This is a gut program, 8 to 12 weeks. Berberine, cat's claw, and grapefruit extract are all natural supplements that have been shown to wipe out bad guys, wipe out viruses, wipe out yeast. And then we want to clear out all those bad guys. Then we want to re-inoculate with good guys. So this is probiotics. This is 225 billion, with a B, billion colony-forming units probiotics. So this is a very strong probiotic. We gave him magnesium glycinate. Now, how much? Like one of these scoops here, this is the type that I like. It's from Seeking Health. It comes in a powder, right? So 1 to 6 scoops per day mixed with water, and then you sip it the whole day, up to 1,200 milligrams. If you get loose stools, then you've had too much. So a lot of times when it comes to Floxies, is they're taking all these supplements, but they're not taking very specific supplements, and the supplements that they need to take aren't in the volume. It's not enough quantity of supplement to actually pull the needle to healing. Magnesium threonate is a very particular magnesium that can cross the blood-brain barrier and get into your brain, so you can use the magnesium in your brain, use the magnesium in the mitochondria, use the magnesium to produce energy. So magnesium is needed in over 400 enzymatic reactions in your body. So you must get magnesium into your brain, into your cells. In my opinion, magnesium glycinate powder is the best. Now, fish oil, people say, yeah, I take fish oil. How many do you take? I take 1 to 2 capsules a day. So this here is a liquid fish oil. You take 1 to 3 tablespoons per day. That's 5 to 15 grams per day. So if you take capsules, right, 1 tablespoon roughly, you'd have to take about 10 capsules, right? So like the liquid is the most economical form to take because it's not packaged. So you can see we've put them on high super dose fish oil. Why? Because fish oil is a natural anti-inflammatory. It's needed for your brain. It's needed for your gut. We just didn't give them 1 or 2 capsules. We super dosed on fish oil. So this is where the nuances of functional medicine comes in. This is where clinically, if you go through these cases, you're going to see general basic principle foundations that I've applied to people that have gotten people better if you're taking the online course here. So this is real critical, is the volume of supplements. Now again, there's always outliers that need very specific programs. So brain octane, I have a whole video on brain octane. This is a very specific fat. So to kind of give you the background, it comes from coconut oil. And coconut oil has about 5 different fats in it. So this right here, the brain octane, is what we call caprylic acid. It's a very particular type of fat in there. So to get 1 tablespoon, of this brain octane, you'd have to consume 18 tablespoons of coconut oil. So this oil is high octane power to get into your brain, to get into your mitochondria, to get in your cells and start producing energy. Because when people have been floxed, they don't produce energy, right? The medication, fluoroquinolones, destroys your mitochondria. So we need to give the mitochondria the easiest energy source possible, so those mitochondria can start producing energy. The fluoroquinolones actually literally destroy mitochondria in your body. So this program here, it's a gut program, it's an energy program, it's a mitochondria program. So we had him take 1 to 3 tablespoons per day of the brain octane. So you just can't jump into this. You have to slowly go on a gradient scale and scale up to these supplements. I also had him do what we call bulletproof coffee, Kerrygold butter, bulletproof coffee, and then I had him watch these videos here that are on my website that you also have access when you take the online course. Lion's mane mushroom, this stuff is powerful. This is for your brain. It helps your brain, helps memory, helps calm your brain, makes your brain fog disappear, your brain fatigue disappear. This is amazing stuff. So it's lion's mane, 2 caps in the morning, 2 caps in the afternoon. And then we also had him do lithium orotate, which is you use this in combination with 9 and 10, right? So lithium orotate supports your brain chemistry, so the brains fire better and your brain heals much better. So here, this is vitamin D, 4 caps pulled per day, or 20,000 per day for a month. Why? Because his vitamin D was 12. Where do we want it? We want that to be around 80, okay? 80. And after that, after a month, then he takes 2 of these per day. Homocystex Plus. This is a very powerful B12 with other nutrients that help the mitochondria and help energy production. So there's very specific nutrients that I work with because I know the quality. I know that they get results quicker, better. I also had him watch a video that I have, and of course you have access to this as well. It's on the homocysteine. It's on homocysteine and what this supplement actually does to produce energy and help DNA function better. And then I also had him take another supplement, 1 cap 3 times per day. This is a high dose B vitamin, which has several different B vitamins in it. Okay, so then here, so the date here you can see 7/28, so July 28th. Then it took him a few months to, I don't know, months or a month to get the supplements. So then here on basically September 3rd, he was on the supplements for 2 weeks. So it took a while for him to get the supplements. So the last 2 days he's been doing very, very well. Started the supplements gradually. He's been taking all the supplements out, feeling better. Mental health better for the past few days. Agitation, brain fog, less edgy, anxiety better, memory better, brain fog better, and panic attacks better. Now this is on the supplements, all the supplements for only 2 weeks. He's getting these results. Now he's still having some problems. He's still having some eye flutter. I asked him some details about his eyes, and he's still having some problems with his eyes. He's been on all the supplements, I guess, for 10 days. So sleeping better, and he will still have some nightmares, but they're not as pronounced. They don't keep him up. He doesn't wake up with anxiety and stress. Panic attacks much better. Now here, he was saying that he felt better for the past 2 days, right? He was only on the supplements for 10 days, and for the past 2 days, he felt better. So I wanted to have another Skype call with him 7 days later, right? So this is the week after that. 7 days later, I wanted to have another Skype call with him because I wanted to see, are we still moving the needle in health, right? So after 2 weeks, so he's on the supplements for completely 2 weeks, right? So he's getting better than last week. Mental problems and panic attacks significantly decreased. So what did we do? We cleaned his gut. We gave him good nutrients for mitochondria. We gave him good healthy fats. He changed his diet. Very specific nutrients to get him better. Now again, in my clinical experience, there's a basic foundation that can get most Floxies better. And this is the basic foundation. Then there's always outliers that are going to need some specific functional medicine care. Sleep is better. Appetite's better. He's still having some eye floaters in his eyes. Fatigue is still a problem. I told him to continue all the supplements for another 2 months, so he'll be on the supplements for roughly almost 3 months. When you're moving the needle in the direction of health, you don't want to mess around with it. So this is a very good program. He's getting phenomenal results. And then he also wanted to start glutathione, so we're going to start glutathione and move from there. So we've had basically 2 calls with him, but the guy's like 180 difference in a matter of a month being on the functional medicine program. So I hope you found value in this. I want to just leave you with this. You can get better. There is hope for you, and you don't need to be a victim of being FQ'd, and you can get better. Take care.